Hi everyone, this is Greg Stone at Peachtree Health. Today I'm coming to you from the shores of the beautiful Yuba River, our namesake here in Yuba County. But I'm not here to talk about the river itself, but I'm here to talk a little bit about what rivers do. In our area, rivers act as a natural boundary to a lot of our counties. The Feather River between Yuba and Sutter, just downstream. The Sacramento River, a little bit west of that, between Colusa and Sutter County. But I want to talk about the Bear River, a small seasonal river that's south of Yuba County, between Wheatland and Sheraton, separating Placer County and Yuba County. It's perhaps one of the most interesting health rivers in the region because it separates one of the healthiest counties in the state from one of the least healthiest counties in the state. You know, if you look at the California state health rankings, just based on all health outcomes combined, Yuba County has for a long time fallen in maybe the low 5, the worst 5 counties in all health related episodes in California. But if you drive just a little south of there, towards Wheatland, just over the border into Placer County, just over the Bear River, you go to Placer County, which is historically one of the top 4 healthiest counties in California. So how can that be? How can so many people live so close to each other and have such dramatically different health outcomes? It's an interesting conversation that people have about causation. Does where you live cause your health issues? Or is it just a correlation? It just happens to be that all the folks in that area happen to be less healthy than others in another county. Health outcomes come from a lot of different ways. It's environmental for some, right? Your water, your air quality, your environment you're living in. Is access to health care. Can you get the health care you need, both preventative and urgent when it's needed? Can you manage your chronic disease as well? Do you have a community with a lifestyle of health care? But also, what is the race and ethnicity? What is the relative poverty level? The income, the housing, the schooling, transportation. There's a lot of things that directly impact a community's ability to get and have health care. I think that's what you see. I live in Yuba County. I see it, both the good and the bad. And I'm frequently crossing these rivers into other counties. And I often think I'm crossing into a healthy area, a dramatically healthy area in some areas. So is that just because that's where the wealthy people live? Is that just where the healthy people get together? Does the county have something to do with it? The way they've organized themselves around healthy communities and access to care? Is it just an income issue? Is it just an employment issue? It's probably a lot of these things. But think about it as you cross these rivers and the easy bridges across the different counties. You're moving in and out of dramatically different health environments, all because of their zip code. It's a generational problem. It's something that we in healthcare advocacy really try and impact. I think we do. I just think the yardstick's really long. And to see an outcome for what we're doing today will be well beyond our time as healthcare providers. So that's it. Thanks for listening today here at Sunset on the Yuba. I look forward to talking to you guys soon. Take care. Be healthy.